Hello, my name is Adeas Figueroa Torres, and my question is, do pro-parenting policies have a positive impact on job retention and satisfaction among working parents? The objective of this project is to instill knowledge while creating a path of guidance in regards to pro-parenting policies in the workplace. Creating policies that allow for work-family balance enables both business and individual gain, whilst changing the social construct and framework of both the workplace and ultimately the nation. Question: do pro-parenting policies have a positive impact on job retention and satisfaction among working parents? Below are the terms used in this research project. What is the significance? There is a significant amount of work and family conflict in the workplace, especially so for working parents. Lack of social as well as workplace supports lead to high turnover rates, low staffing, and increased mental, emotional, and financial burden on individuals, businesses, and families. This ripple effect of unresolved support, advocacy, policy, and understanding has considerable negative effects on society as we know it. Creating a structure to offer a way to advance unresolved work, family, and workplace social understandings could be helpful in solving the many crises faced by working parents, businesses, and nations alike. The project timeline is immediate action. This is a human rights issue. This is a workplace issue. This is a social issue. And if we don't fix the structure that is now, the system will never be fixed. Current practice at my workplace, although it's evolving, it is very unresolved and outdated. There is a breastfeeding room, that's a win. Now, because of COVID, people can go part-time without losing benefits. People have had to quit, especially females, due to not having childcare at home. Nevertheless, there are many still unresolved issues such as staffing shortages or inadequate staffing, not enough paid work, a lack of understanding in regards to mental, physical, financial, and emotional implications facing the working parents. This also affects those around who have no children, and in turn can cause a hostile work environment. When the worst happens, it becomes a human rights issue. So this is the print screen of a shot of an article that stopped me on my tracks. The article published by the New York Times was the article that inspired me to look further into pro-parenting policies at the workplace. Parents are left with the horrendous aspect of choosing the life of their children over their ability to provide for them. This was a woman with a career and moderate income. For women with low-paying jobs in the inner city, a stranger, neighbor, or boyfriend may watch the children. In that case, codependency, abuse, neglect, and death can occur. The pandemic is highlighting this issue as now everyone is aware of the struggles parents face in the workplace and the outdated architecture of the business system when it comes to balancing family and work. This is a quote by Amber Scora. This is the mother that had lost her child on the first day back to work. There are plenty of good examples of how to create a national parental leave system that works. Our children can't afford lobbyists. It's up to us, parents, to demand more. And she could not be any more right. Overview. Lack of pro-parenting policies lead to the gender gap and discrimination disparities in the workplace. Losses from businesses. Lack of retention, hiring travelers, profit loss, decreased patient satisfaction services, decreasing funding. Losses for parents, higher daycare costs, calling out, financial instability, lack of education and workplace advancement. Women choosing to have children and stay home, the gender gap, or have no children at all, decreasing future workforce and ultimately the population of a nation. Poor outcomes, poor mental, emotional, and physical health outcomes for staff, creating more money that has to be spent on insurance in the workplace. So first, we need to understand the top three problems. Problem number one is the Civil Rights Act of 1964. It protects women from discrimination, but for a mother with children, the same equality granted to a woman to not be treated differently from men also causes women to have to swallow motherhood and figure it out. They never took into account that women have children. Problem number two. There are only several options available here in the United States of America. We have the Pregnancy Discrimination Act, also known as PDA, the Family and Medical Leave Act, also known as FMLA, and paid time off, PTO, and short-term disability as provided by the employer. Now, not everyone qualifies for these benefits, and as for PTO, well, you have to be approved by your supervisor. Step 3, there is little to no protections for breastfeeding, pregnancy, and parenting in the workplace for U.S. workers. Perception is oftentimes the biggest issue, seeing parents as a huge loss to profit. So there are pros and cons. The cons is you have to change the whole system. You have to create a reform in the business system and a reform in the mindset of the people. The second is accountability. Businesses would be held accountable if it was changed federally or state-wise. During the primary phase, investing and funding for employees could be a huge pushback from the business system. And now, pushback from old mentality of what the workplace is. Pros. Giving control over work time arrangement closes the gender gap, increases workplace satisfaction, and increases productivity. It also increases retention and fiscal growth for the company. Pro-parenting policies help alleviate short staffing, keep educated and trained individuals within the company, and leads to good reviews and outcomes. The positives of pro-parenting policies far outweigh the negatives. Findings from around the world. Africa. Work-health balance as well as ability to use PTO as desired without constraint was found to be important for workers with and without children. Not having this led to decreased job satisfaction. Europe. Telework options worked best for parents with special needs children than those without children. Europe. Workplace flexibility, paid leave, FMLA, paid sick days, increased global competition in businesses, state, nation, and increased family and worker satisfaction, creating a healthier nation. China, who has no pro-parenting policies in place, saw a huge birth decline, even though they increased the one-child policy to 2. This caused a steep decrease in population and workforce. They are currently looking at instilling pro-parenting policies to save its economy. U.S. companies with pro-parenting policies in place saw increased retention, increased satisfaction and production, and decreased poor health outcomes. So this is the review of literature and findings. Arrow up is increase and arrow down is decrease of satisfaction with pro-parenting options in the workplace. There was an increased satisfaction significantly and positively related to life satisfaction for dual earner mothers. They're able to complete home and societal expectations. There was decreased satisfaction or negatively related to the life satisfaction of dual earner fathers. This was due to fear of work advancement. 42% of mothers reduced their work hours when they had their first child, and 28% of fathers did the same. 39% of women took time off of work when they had their first child, compared to 24% of men. Mothers were 3 times more likely to quit a job. That's 27% of women versus 10% of men. Businesses stated that the benefits outweighed the cost. State businesses related to increased respect, increased recruitment, and retention. Work-health balance was more important in work-life balance amongst all groups of individuals, and work-life balance was more important in women and the elderly, leading to decreased satisfaction in the workplace if pro-parenting styles were not in place. There was an increase in satisfaction in work-life balance for parents of special needs children when they were able to do teleworking. Increased satisfaction for non-children workers as well when they were able to do teleworking. There was an increased global competition in business, state, and nation for family and worker satisfaction, and that equaled a healthier nation in general. The population in China decreased in workforce. Women were staying home or choosing not to have children at all and to focus on their career. There was a decrease in satisfaction in men who must work apart from family, with increased workplace demands from shortage. There were increased outcomes of productivity, satisfaction, retention, and recruitment in places that had pro-parenting policies. Pro-parenting policies increased the retention and improved mental health and physical health. Non-pro-parenting policies increase turnover, decrease mental health, and decrease physical health. So how would I implement this into my workforce? And how can anyone implement this into the workforce? Actually, it's fairly quite easy to implement. The hardest part is the backlash. So I'm going to use the implementation science model, pretty basic. This is an immediate implementation with constant education and remodeling. Timeline is only for satisfaction surveys, annual retention counts, and fiscal monetary prosperity results every 6 months. So you first start with a prototype. You design and tailor your implementation strategy, such as paid parental leave, PTO use, not only in emergencies, flexible time scheduling, paid sick days, workplace flexibility, employee work share, and telework options. These are considered incentives and would be a reason why people would float to your job. Then you would share this. You would specify and test a change, see how many people you're keeping in retention, see the satisfaction surveys, and see your fiscal monetary prosperity. You would share this information with other people. You would make this more public, and it is within that satisfaction that you increased your profits. You refined it. You conduct a more effective and discrete research tailored to your implementation strategies. Maybe flexible time scheduling isn't for your business, but PTA, paid sick leaves, and workplace flexibility is. Maybe you can't do telework options, so that's something that you can't do from there, especially in a high acuity unit. So maybe the other ones are like PTO, flexible scheduling, workplace flexibility, and employee work share. So you have to work it for your business. And then you want to get the feedback. You want to increase economic evaluations and finally improve tracking and reporting. Let's see where the satisfaction surveys are. Are we getting more grants because there's better patient satisfaction surveys? Is there an increase in positive and patient satisfaction surveys? Is there more retention annually? Are you having to spend less money on travelers or on overseas visa? So conclusion, limitations, and going forward. Aside from the huge lack of research available due to there not being a lot of pro-parenting policies in business nations, a lot of the pro-parenting policies I saw were nations where there were healthcare for all, or in Europe where they were testing a lot of these strategies and the mindset starting to change, and even Africa where family is thought to be something that's important, especially when it comes to elders. Here in the US, there's not a lot of research available. It is left to the businesses. So pro-parenting policies are at the mercy of state and national reform here at the US. Workplaces are allowed to do the minimal necessary and essentially write the law for employees. Having them buy into the positives of pro-parenting policies is the first. Changing state and national frameworks is the real issue. Advocacy for pro-parenting policies start with policy in the state and government levels and implementing paid parental leave, universal health care for all, and precautions for parents in the workplace. Another issue is changing the mentality of individuals about gender, womanhood, what is considered maternal or fatherly, and that work-life balance is important. Signs, posters, videos, advocacy, and engagement of these tough conversations, such as the conversations we have about workplace harassment and inclusion, are just as important in changing minds and creating a wave of change, not just in the workplace, but as a nation. Policy intervention is immediate, and it is not about implementation, but about changing the framework of the workplace and nation. The workplace, healthcare, and social justice are all intertwined. This is a battle outside and inside the workplace. These are my references, and thank you so very much for watching my presentation.